Cerebellar testing. First test, dysdiadochokinesia. This is testing rapid alternating movements, looking for breakdown of the movement, usually the hands with the arms out straight at shoulder height. This tests the ipsilateral cerebellum. Most cerebellar tests are not specific, as they do not rule out the contralateral cortical involvement. This can be used as a neurological test, or getting the person to attempt the movement and muscle test the same arm. Must test one arm at a time to give unilaterally. So the right cerebellar test. Patient activates movement in the right hand. This information goes to the right cerebellum and thus to the left cortex. The doctor tests the right deltoid for integrity due to motor decussation from the left cortex to the right side of the body. Push up. Left cerebellar test. The patient activates movement in the left hand. This information goes to the left cerebellum and thus to the right cortex. The doctor tests the left deltoid for integrity due to motor decussation from the right cortex to the left side of the body. Push up. Close your eyes and the right index finger to your nose. Take it away and your left index finger to your nose. Take it away and open your eyes. Okay. Number 3, the Wally-Smith test. So close your eyes and bring the tips of your fingers together in front of you. And also note for any drift of the fingers, and separate them again and open your eyes. Right, number 4, eyes closed. This I call the Michael Allen test. Lift the foot up the shin as if washing in the shower. Repeat the same thing, eyes closed, lift the left foot up as if washing in the shower. Physiological blind spot testing. The patient stands the distance of one A4 piece of paper away from the wall. The piece of paper is applied against the wall and an X is placed in the middle. We're going to test the right eye first, so the patient covers the left eye with their left hand. Now keep looking at the cross and tell me when the tip of the pen disappears. So you keep looking at the cross.
There.
And tell me when it reappears. Keep looking only at the cross.
There.
And then we're going to go down. Tell me when it reappears down.
There.
And tell me when it reappears up.
There.
Excellent. Then swap hands. So you cover the right eye. And looking with your left eye only at the X, and tell me when the tip of the pen starts to disappear.
There.
And tell me when the tip of the pen reappears.
There.
Excellent. Then I divide it into 2 and go down. So tell me when the tip of the pen reappears downwards.
There.
And then we'll go up. Tell me when the tip of the pen reappears going. So now we've completed the 2 physiological blind spots. We join the dots together. First of all, I'm doing this on the right hand side and then on the left. And we can see very clearly that the right hand blind spot is considerably larger than the left. The side of underactivity of the thalamus is on the opposite side to the larger blind spot. So the basal ganglion test. Saccades, or rapid eye movements, are good at eliciting the basal ganglion, but doesn't rule out entirely frontal lobes, mesencephalon or pons to a degree. The basal ganglion are difficult to elicit as they are not directly involved in output. It's necessary to stress them in more than one way and to look for consistency. What we also have to remember, the rapid eye movement is also a test for aerobic respiration. Rachel, I'm going to give you some numbers and I want you to repeat them to me. 813138.
813138.
Good girl. So Rachel, I want you to march on the spot. So first of all, close your eyes and then march on the spot. Off you go. Right. Stop, keep your eyes closed, and I'm going to test your right deltoid push-up, which is going to challenge the left parietal lobe. Carry on marching on the spot. Stop, keep your eyes closed, and I'm going to test the left muscle, push-up, which challenges the right parietal lobe. So you look straight ahead. I'm going to stimulate the left field of vision here. And while Rachel's looking straight ahead, I'm going to test the left deltoid muscle, which should remain strong. And then I'm going to swap over, still stimulate the left field of vision, and you're going to test the right deltoid. The right deltoid becomes inhibited. This is normal. So I'm going to stimulate Rachel's right field of vision. And the right muscle here should remain strong. And I'll stimulate the right field of vision and test the left muscle, which becomes inhibited. This is normal.